Hello and welcome to Filibusters in Fine Print, where AMGA's public policy team gives you the insider view on healthcare regulations and legislation. Thanks so much for joining us for the latest from Washington, D.C.
Good morning and welcome to AMGA's Filibuster in Fine Print podcast. Glad you all are here to listen in. Someday you might be able to even see us, but that is TBD. We have a meaty agenda for today. We're going to talk about the government shutdown. But before we do, last week we talked about what our favorite bands were. So how about today? What's your favorite song?
Ooh.
Yeah, what do you think? And by the way, this is unscripted. So this is sua sponte. I'm a lawyer, I can say that. But Lauren is having difficulties.
Yeah.
Alicia?
One of my favorite songs is With or Without You by E.T.
Oh, that's a good choice.
Yeah, well done. Well done. Jamie?
A song I think it's a good song that makes me cry. It's Ave Maria. That's a good one.
Very good.
When I hear it, I'm like, if you're a good opera singer and it makes me cry, then I'm like, if I don't cry, I'm like, I shouldn't have to pay for the ticket.
That's the most Jamie answer ever.
That really is.
I want emotions.
Well done, staffer over there. Okay, super. Daryl?
So when I got LASIK done, they let you pick your song. So I think I have to go with Everlong by the Foo Fighters.
Oh, that's a good one.
That's a good one.
Slatney?
I'm going to go with As by Stevie Wonder. It's a great song. It's very karaokeable singing that you could do to it. And that was a fantastic album. You know, songs in the keep life.
So which
All right.
ACT song is yours?
Well, as your host, I have to say there's only one great song, and that is Freebird.
Oh, gosh.
So, those fine young men from Jacksonville, Florida.
Do you have to wear a jean jacket when you listen to that song?
Yeah, that's upstate New York, man.
Yeah, you have a Firebird with the T-tops or whatever they're called?
They're in my school, they were. Okay, anyway, so let's go on to the government shutdown. But thank you for your candid answers. All right, let's talk background around shutdowns. Get that done first. Alicia, what is a government shutdown?
So, federal agencies can't spend money without approval from Congress or appropriations from Congress. So, without the annual appropriations bills being passed or funding legislation, agencies have to shut down to any non-essential functions. But Social Security and Medicare benefits still continue to flow, though those offices may not be open. And essential functions such as law enforcement, TSA, they continue to work as well, but nothing else. And Congress can pass a continuing resolution, or a CR as we like to call it, and that allows temporary funding until a specific deadline. And currently we're working up onto a March 14th CR deadline. Stumbled over my words there.
So we have 15 days, is that right? Till the government runs out of money?
Possibly. Yeah.
My federal employee sister and brother-in-law, I'm sure, are a little worried about that. So how common are these things?
I want to add a little bit to that.
James is going to jump in. Okay.
Sorry, I was add that as a former worked in the budget committee, like there's mandatory and discretionary. Mandatory Medicaid, Medicare benefits, but discretionary spending is what we're talking about right now, and that's what Congress has to approve. So just a little more intrigue into it. That's
Okay. So no park rangers if there's no government funding.
correct.
Got it. Okay.
But you can get your Social Security check.
That's important.
Yeah.
All right. So how common are these things?
Actually, in the grand scheme of things, not very common. So there have been 20 funding gaps since the 1970s, which means like maybe the government was like not funded for a day and then they appropriated funds the next day. But over the last, like you're talking about a true government shutdown, there have only been 4 since the 90s. The most significant one was between 1995 and 1996. That's during the Clinton administration when they were battling Newt Gingrich and the Republican Congress. So that was, the government shut down for a total of 26 days. What's very memorable about that is during that 26 days, Bill Clinton was very bored. He had no staff to talk to. And there was someone who may have shown up that may have caused him to be impeached during that time. So you gotta
keep busy.
Keep busy. You have to have staff.
Keep calm and keep busy.
Yeah, so people can talk to it at all times. And then there was one in 2013. The House and the Senate did a little standoff about the ACA, and that was a 16-day shutdown. And then the fourth one, that was recently. It was 2018 and 2019. It was a partial shutdown. So 5 of the 12 appropriation bills had already been enacted, but there was dispute over the border wall. And so it was the longest lasting one was 35 days.
A long one, and that was Trump won.
Yeah.
Wow. So, okay, so there's some history with this administration about that. Okay, so impact for average Americans. What happens if there's a shutdown?
Well, Jamie made a good point. There is mandatory and versus discretionary spending. So you have like Medicare, you're still going to get your Medicare checks. You're still going to get Social Security. The government's still going to run kind of on a little bit of a skeleton crew. So you'll still be able to travel. TSA agents, if they show up, still have to function. A lot of things will still get processed, but you know, if you have SNAP funding, you get SNAP funding. But so those are the everyday things. National parks is always big too, because like we saw during the last shutdown, when you do honor flights for veterans, they would show up at national parks, including DC. Everything DC is basically a national park, and they were not allowed to go in because the government was shut down. And so you saw a lot of media around people seeing like actual impact on people every day. So it really just truly depends. Office of Personnel and Management and Budget, they're the ones who kind of release what these guidelines are going to be per agency. You can find those online. But if you're looking at everyday things, you're going to see cash flow. You're going to get in the mail. The mail is a different funding source, but little things that you might think about: how long it's going to take you to get to the airport, right? If there's a skeleton crew of TSA agents, how long would it take you to catch a flight? Those are the things that kind of catch up with you. Probably when you see day 7, I think when people kind of realize, oh, I'm going to be impacted in some type of way.
And AMJ has our annual conference, so we need to have TSA agents because we're all flying there.
We're all flying there.
So that's important.
And these federal employees that you mentioned, like who are working out of the almost goodness of their heart, like they're not getting paid. They will get paid when the government comes back. But so if you think they're in bad mood now, imagine a TSA agent that comes there, doesn't get paid, and hopefully Congress will fix it. So, you know, it's and with passports and other stuff, that's going to slow down. There's a lot of inconvenience, but you're right, it won't happen until like 7 or 8 days.
I also want to point out that Congress still does get paid.
Yeah.
Yeah, they still get paid. Yeah. But I remember, I don't know if you, like, when there was a shutdown, it took, I think, almost an hour for me to get into my office building during during the ACA one, because, like, again, you're dealing with a skeleton crew of security staff. And so just remember rolling up and like you just see the line like wrapped around the building of staffers trying to get in. You know, a lot of the parking garages shut down. So even though Congress is getting paid, they are still being put in an uncomfortable place because sometimes they will stop staff from coming in, or they'll do staggered times just in order to show that there is an impact in their offices as well.
Very good. All right, so that's some pretty good background around a government shutdown. So what is the actual state of play? So where do things stand as of right now?
Well, I think, you know, we talked about this a couple recently, that, you know, the Congress extended the government funding until March 14th, and the House and the Senate came to an agreement with a bigger package, and that got taken away because of some people in the super cabinet of Trump decided to oppose it. But there was a cleaner, skinnier CR. And right now you have the 4 corners, which are the House Majority Leader, the House Speaker, the top Republicans and the top Democrats in both chambers. They're negotiating right now how to fund the government. It's going to be interesting. There's only, I mean, Congress just left for the weekend, and there's about maybe 5 or 6 more legislative days until this passes. So if they don't, there's multiple ways this could go down. They could shut down, or they could do like a 24-hour, 48-hour CR to try to fix everything. But it's going to be very last minute, and it'll be interesting to see. And I know Lauren's talked about this in the past, and I'd love to hear your perspective. Like, this is something that can't be passed with just Republicans, because there's plenty of Republicans that will not vote for it. So how do you, as a House Speaker, negotiate a bill where you need like 40 Democrats? I mean, I don't
know. Look, they passed Congress, the House of Representatives passed a budget resolution this week. They initially started the vote. They stopped the vote. They told everyone to go home. 10 minutes later said, come back. And they were able to pass it. I think that was largely due to the lobbying of President Trump and putting pressure on members to kind of come through. But so there is precedent now that you can rally Republican voters to maybe get this across the finish line. Uh, they might be on a high right now because they've had this big win so far for the budget resolution, although that is still pending when you think about they have to negotiate this between the House and the Senate. So they might show improve. Maybe.
Yeah,
That's-
we'll see.
Let's see. So it's one thing to pass a budget resolution that has all the Trump agenda items and priorities. It may be another thing for Republicans to pass a bill funding the government with Democratic support. So I guess there's probably maybe some different views on that.
Yeah.
So to add on to Jamie's question to Lauren, what will Democrats want to support a government funding bill? And what will Republicans give, do you think, assuming they have to have votes to pass the government shutdown bill?
Democrats want to make sure that Medicaid is going to be protected in some sort of way. They're going to want a lot of concessions in terms of their agenda, sort of things we saw last year, making sure that, any sort of liberal agenda thing, right? Like you're thinking about funding certain programs that might go away. If you look at some of the resolutions, even though it's slightly different, Democrats are talking about protecting government agents, government employees. So you could see them putting in some sort of guarantee that if something happens, be in the law, you cannot fire a massive pile of people.
Mm-hmm.
Republicans are not going to want to do that. And so Democrats haven't really rolled out their agenda yet because I think they're trying to keep their cards to their chest.
Okay.
So, there was a press conference with Leader Jeffries and Minority Leader Schumer, and they basically pivoted to their appropriations chairs. They were like, I don't know, what do you think? So they're not going to go on record to say anything about possibly coming over and helping Republicans. Now, today in the New York Times, James Carville, a relic from the 90s, he got dusted off of his museum and put back in front of the New York Times column section. And he was like, Democrats should just go limp and not do anything. Don't help Republicans at all. Don't give them any sort of, as all these things are going on, just be silent, just be immobile, and let Republicans ruin this for themselves. There are going to be moderate Democrats who cannot agree with that.
Mm-hmm.
And I think you're seeing the struggle in the party about action versus just letting all the chips fall where they may. And that's why you're sort of seeing a less cohesive stance. I know that Minority Leader Schumer on the Senate side is we're not going to help Republicans at all. You're not hearing that on the House side yet.
Mm-hmm.
Because you're thinking about 2 years from now, when there's a midterm election, you're thinking about, are we going to be blamed for this? So you're watching the House Democrats and where they go will be probably the bellwether at all of this.
Okay, fair enough.
I think that you mentioned you talked about the Doge impact on bipartisan work, and it's not just Democrats that are upset about Doge. I mean, there are plenty of rural Republicans. There are Republicans who have big federal entities in their district, and those constituents are complaining. It's going to be interesting, with the shutdown of USAID, not the shutdown, but the unraveling of it, how that's going to impact rural America and contracts and things like that. So right now, there's been reports of Republican members getting yelled at in town halls. I'm not saying that's going to make a Republican vote yes or no on anything, but they're definitely, as time goes on, as Lauren mentions, there's going to be more and more impact of the Doge impact.
Yeah, because you know who shows up to town halls? It's not young activists. It is older people who have
Senior
time
citizens.
on their hands. And they're going to show up anyway, right?
Yeah.
I think of my great aunt and her old lady gang. They show up to every school board meeting in my hometown, to the point that the school board changed the time when they met to try to avoid these ladies. And so when you have time on your hands and you're seeing the news constantly, you're going to want to say something.
And I've been to those town halls when I was on the Hill. Senior citizens are mean. I love my parents. Okay. So we talked about some of the state of play legislatively. We obviously want the government to be funded because we're government advocates at ANJ. But we also have things in there that we want to be included, including our Part B reverse fix, as well as health extensions, etc. Daryl, there are some reg issues related to a government shutdown as well. Can we?
Lauren and Jamie sort of alluded to this. So, each department and agency has to put out a shutdown plan. And I was looking into that. And right now, all the websites are scrubbed clean because of the Doge effort. So you have to go to the Wayback Machine to dust off what happened the last time around. And, the long and short of it, Medicare claims are going to be paid, right? That's not an issue. That's a mandatory funding, like Jamie mentioned. Now, the issue is who is around to sort of manage the program and oversee the program. And about half of the CMS staff is going to be furloughed. And that's just if there's a shutdown. Now, what also is happening is OMB just yesterday put out this directive for this reduction in force for each agency. So there's that going on as well. So how these sort of marry together is going to be, it's really an unknown thing. But, top of line, Medicare claims are going to be paid. But there won't be the CMS staff to oversee the MACs. So if you have a problem with the MACs and you need to call up CMS, there might not be someone to answer the phone. If you need to change your provider enrollment, those folks might not be around. If you have any sort of issue with the Medicare program from a provider perspective, the folks that you would call up largely aren't going to be there, or that next level up beyond the MACs aren't going to be there. They're likely going to be on furlough. So while your claims might be processed, everything else with the Medicare program is going to be not entirely shut down, but incredibly difficult to navigate.
Okay. And now, so keeping on the regulatory side of things, what happens to telehealth waivers if there is a government shutdown?
So they are going to expire, Jamie, April 1.
March 31st.
Yeah. So those need to be extended, whether it's in the CR package or through some other means. But, CMS is very upfront. Like, they don't have the statutory authority to continue those flexibilities and waivers. So absent congressional action, the geographic and originating site restrictions snap back into place. And, you are more than welcome to continue to provide those services, but those claims are just going to be denied. Like, you cannot provide those services and expect Medicare to pay them after those points. So it really snaps back to a pre-pandemic, pre-public health emergency world. And so we need Congress to act on those.
All right, and I guess to our final point, I think, so we talked about our Part B conversion factor remedy that we need passed. Daryl just talked about telehealth. There's also hospital at home and our APM bonuses. So all these things Congress needs to include in the government funding bill, hopefully by March 14th. So, Alicia, why don't we end with you talking about how we get our members engaged and making sure Congress knows about all these things.
Yeah, right now I'm running a grassroots network campaign in support of having our Medicare Part B fix included in the March funding package. So if you're interested in that, please reach out to any of us at the public policy team and they will connect you with me or I will connect you with the letter. And we also have our district advocacy program, our DAP program, which Lauren runs, and that is the easiest way to get yourself in front of your House office, your Senate office staffer, because those are the people that are writing the legislation and are really doing a lot of this work. And you can get in front of them and tell them exactly how important it is that you have the funding that you need, whether it's Medicaid, Medicare funding. And you can have your member come for a member site visit or one of the staffers come and they'll visit you in district when they are out of session. And you can show them exactly the work you're doing on site.
Those are hugely effective. So we welcome all AMJ members to contact us, and we will get you in front of your member of Congress and their staff. I think that's it for today. So thank you very much, and have a good day. And you all were cooking.
Thanks for joining us for Filibusters in Fine Print. This podcast was brought to you by AMGA. For more information about AMGA's advocacy efforts, visit amga.org/advocacy.